I'm feeling a bit rubbish today. A few weeks ago now, in an urgent care appointment, I saw a patient who had not seen a dentist in several years and was attending with a toothache. And when I looked in their mouth, I discovered what I believed to be oral cancer. And I've just had a letter back saying that it is. And I'm just feeling so frustrated and let down by the NHS dental system in the UK at the moment, because that person hadn't been able to get into an NHS dentist for years. And it's so important that oral cancer screenings are done every year. This person had no idea they had oral cancer growing in their mouth. It grows quickly, it grows silently, you don't know you have it. It can go unnoticed, but when it gets to a point where it's noticeable, it's usually too late. The survival chances are less than 5% for 5 years. Early diagnosis is so essential, and how are people meant to get these conditions diagnosed if they're not even able to get in and see a dentist? This is the number of adults in England that have been able to see an NHS dentist in the last 2 years. Less than half everywhere. So in over half of people, cases like this are just going to go undiagnosed. People are literally going to die because of this. So can everyone just do a favour and check their own mouths, check their relatives' mouths, make sure they're checking underneath their lips, the sides of their tongues, the back of their throat. You're looking for anything that looks unusual: lumps, bumps, swellings, red and white patches that don't disappear in 2 weeks, non-healing ulcers. And if you don't have a dentist, every single county has got an emergency dental service that you can ring. Say you've noticed something in your mouth that you'd like to have checked, they will give you an appointment. If you don't know your emergency dental number, you can contact 111 and they'll put you in touch. This is so concerning, so just look after yourselves, look after each other, and always feel free to send me a message. Here's a little infographic on it, and things you might notice in other people is a change in their voice, if they're having difficulty swallowing, if they have any asymmetries in the face. But leave any questions, I'll try and answer all of them.
Guys, what are the kind of current waiting list and assessment times on the NHS? Are we talking 12 to 18 months, or are we talking maybe 3 to 4 years? It'd be really good to hear everyone's experience and how long they've been waiting. Own personal experience is I chose not to wait on the waiting list because at that point they were maybe 4 to 5 years. I done both of my son's ADHD assessments privately, and then I also done my eldest son's autism assessment privately. Once my youngest son did start medication, after a couple of months, it was really apparent that there was a lot of autism traits and underlying traits that I hadn't seen because his ADHD was masking. So CAMHS did refer him for an autism assessment. The assessment itself, I think we only waited 2 to 3 months. Let me know how long you guys have been waiting. Has anyone else chosen to do it privately? Have they had any situations with the private diagnosis then going over to CAMHS? Let's hear everything.
GP appointments. Guys, why is it so hard to book a GP appointment? But if you want an appointment, call between 8 and 12 AM to PM. But you call at 8 o'clock and then I'll get 8 o'clock on the dot, the GP is closed. Then I think, okay, maybe I'm too early, give them at least 5-10 minutes. I call again, then it says you're in the queue and you're number 34 in the queue. God help me. That's fine. I'll wait. I'll just sit there patiently and think someone's going to answer the phone. Eventually they answer, then they hang up. Then you have to do that whole process all over again. And then when you eventually get through to someone, it's like you and that person are enemies. And all you want to do is not even speak to, is book an appointment to see your GP. The first thing they say to you is, no appointments. You haven't even explained to them what you want. And then once you do explain, oh, I'm not feeling well, I really need to see my GP, I'm having problems, or I've got a chest infection and I need a starter pack, they they just shut you down. It's a quick no. Like you said something against this. It's crazy because when you eventually do get to see a doctor, it's either the doctor's going on YouTube to find out what's wrong with you, or they're just going to give you cocodamol and painkillers, or they'll give you antidepressants because they'll tell you that you're depressed, but all this time you just have a chest infection. Then the doctors wonder why nobody really wants to book an appointment with them. I don't know, is anyone else struggling to book an appointment with their GP? Because maybe it's just my GP, or maybe I just need to find another GP, because it's shocking. It's really shocking. And they're dealing with people's lives, so the receptionist needs to be more considerate and compassionate, because it's like you're fighting just to get a GP appointment.
Quickly talk about the GP system in this UK. Yeah. So, I have to call at 8 o'clock in the morning. I'm behind 500,000 people. I finally get to the front. The woman says to me on the phone, "Oh, we need to book you for a telephone appointment." Babe, I need my blood test done. What are you talking about? What do you mean I need anyways? Get a telephone call. You're going to be called between 8 a.m. and 12 p.m. at night. Okay, fine, whatever. Get a call. "Oh, you need to come down." Cool. You go down there. Very rude little lady at the desk. No morning, no hello, no nothing. "What time's your appointment?" Look at me as if I'm boo-boo the foot. Who are you talking to? And who are you looking at like that? Very rude. I'm very polite and respectful. I expect the same. It's a normal, but anyways, then sitting down in the waiting area. Bro, why am I waiting 20, 30 minutes with no apology? No nothing. And the thing is, it might not be your fault. But you could just say sorry. Sorry for the delay. Because that's what anyways. But if I'm late, if I cancel, party's done, don't ever come here again. You're now off the booking system. Don't ever come here again. And it's the same thing for these beauty therapists. Why is it you got to put down a deposit, but if I'm late or if I cancel, deposit done, don't ever come here again. Blocked on social. But if you're late or you cancel, then it is what it is. No, bro, no. I'm going to start charging it to the game. I'm putting it back on people from now on. You are taking 20% off of my... Yo, we got to start charging it to the game.
I just wanted to draw your attention to something important because I don't think it's had enough attention today. Some information has come out from the Office for National Statistics about NHS waiting lists, and it looks like the numbers that are put out by NHS England showing the number of patients waiting on a waiting list at the moment in England are wildly inaccurate. NHS England are saying that there are 6.3 million patients waiting for something in the NHS. And these new statistics show that almost 10 million patients are waiting. Now that is a big difference, and some of that is because some of these patients are being sort of hidden by the NHS England statistic reporting. Because if a patient has initiated treatment but is waiting for some kind of follow-up test or something like that, they're not included in the NHS England numbers. I want to talk about the waiting lists because I think it's very important. Firstly, waiting lists and the numbers involved have been thrown at us almost continually now for a couple of years by politicians. Rishi Sunak in particular has used them as a political priority. He has then involved private companies in bringing down the lists. He has used the lists as a way of bashing NHS staff for taking strike action. And he has celebrated any minor win in terms of these waiting lists. Now we find out that the numbers he's been using might be wildly inaccurate, but there's a broader situation as well. It's politically convenient for politicians who are pro-privatisation to focus on NHS waiting lists as the primary driver of problems in the NHS at the moment, because private companies are coming in, swooping in and taking on work from the NHS. It's very attractive to them. Meanwhile, politicians who are devoting so much attention to the waiting lists and telling everybody how desperate they are to reduce them are ignoring the capital infrastructure in the NHS, the poor pay that staff are receiving, the under-resourcing, the problems with crumbling buildings. All of these things deserve their attention and they're not receiving attention. And just this week we have seen information about likely number of patient deaths in A&Es because of A&E waits. But that doesn't have much attention from politicians either, because urgent and emergency care is barely privatised at all in the UK because you can't make a profit from it very easily.
I'm speaking out. It is a truth commonly known, but not usually accepted by oneself, that may not care about issues until they directly affect you. In the middle of January 2024, I was put on the waiting list for a double jaw surgery. A week before I was added to the waiting list, the waiting time was expected to be 52 weeks, i.e. a year. However, unbeknownst to me, the week I was signed up, the week after I was signed up, that was bumped up to 65 weeks. I may now have to wait until February 2026 to receive my double jaw surgery. NHS waiting times are at an all-time high, and this cannot go on. The National Health Service has many benefits, but while they do see to everyone and provide free care, one of the drawbacks is they may not see to everyone in time. Luckily, my case is not entirely time dependent. However, as someone with severe health anxiety, diagnosed by a GP in 2022, and someone who recognises how stupid it would be to just get a job and then have it short term, and then the employer pays me for like 6 weeks leave while I recover for a long time, because that's the reason why I've been holding off getting employed. I need mine soon. I'm sure there's countless other people in situations probably not similar to this, but close enough. That's why I'll be voting Lib Dems tomorrow in the election for County Council, because they, at least in my area, have promised to tackle this issue. I want to make this a safe space for others as well, so if you have experienced something similar to this, I invite you to share as much of your story as you're comfortable doing in the comments below or in my messages privately, and we can talk, help navigate this together.
Mate, I am living in UK for 5 years, wait an appointment for my son 2 years. 2 years, because my son has autism, but not deep autism, you know, just his delay the speech. So we waiting for 2 years appointment, still nothing for speech therapist. So Keir Starmer, or whatever you say in last name, if he want to change something in this country, I think personal, he need to go first job for NHS, mate. You know what I mean? Like, more, they should put more doctor, or they changing the system, whatever, because the now NHS waiting list is just crazy, mate. 2 years for speech therapist in Turkey. One of my friend son, he can't speak yet, so you know, like, he just gone to doctor, take the appointment for 1 week later, and they start the speech therapist. And in UK we are waiting 2 years. I don't know what's wrong in the NHS waiting list. I don't know why. They actually, like, if any doctor working in the NHS, just explain to me, because like I don't understand why we waiting 2 years. Everything is gonna be late, you know what I mean? Like like special kids or any kids, is they get, first of all, they should be quick, you know what I mean, like to help these kids help the child. But 2 years waiting for kid appointment, it's just crazy, man. I don't know what can I say. It's just like, really they have to change in the NHS system, or they change in the, like, putting the more doctor, whatever, you know what I mean. Like, they should do something about that first job in this country, mate.